you have this concern about painful sensation in your body, you're in luck, because we have an expert on board with us today to discuss all things related to nerve pain. And he is a consultant anesthesiologist, a very difficult name to pronounce. Consultant anesthesiologist and pain specialist from Sunway Medical Centre Velocity, who has extensive research and working experience in this field. And guess what? He's also very talented in tennis and judo. Please bear in mind that we will be having a special giveaway at the end of the session, so remember to stay tuned. Without further ado, let us welcome our special guest of the day, Dr. Khoo Eng Lea.
Hello, everyone.
Hello, Dr. Khoo. How are you?
I'm good. Thank you for having me on this lovely evening.
Yes, have you taken your dinner?
Yeah, kind of. How about you?
I know, yeah, I just had a few bunch. Okay, so Dr. Khoo, I think a lot of audience here are quite curious on actually what a consultant anesthesiologist and specialist, pain specialist does. Do you mind to share, like, usually what do you do from day to day? Like,
so my bread and butter work. It's just, putting people to sleep, making them comfortable during surgery. Yeah, very boring job, Go to work in the morning, wake up at 6 o'clock, 7 o'clock, go to work, 8 o'clock, start putting people to sleep. So there's like day-to-day sort of, day in, day out. On and off, I'll get referrals, and I'll get to see patients which suffer from mainly from chronic pain, means long-term pain. It could be cancer pain, it could be low back pain, it could be pain after surgery, it could be any sort of pain. And I do run the clinic once a week in my hospital, just to see people, just help people who are suffering from pain.
Okay, yeah. So I think a lot of people are not aware of this specialty, right? Like pain specialty. Yeah, a lot of them, they actually know what is anesthesiologist. Yeah, but not very familiar with pain specialist. Yeah, I did work with this pain team before when I was working in the hospital, and yeah, it's quite interesting.
Which hospital were you in?
I was in Hospital Malacca.
Okay, all right.
Yeah. So, Doctor, before we proceed with our discussion, so I'd like to tell our audience that later on we'll be having a special giveaway. It's generous sponsor from our Sunway Medical Centre Velocity. Yeah, they will be giving away free health screening voucher with 391 ringgit to 3 of our lucky winner. So make sure all of you stay tuned to the end of the session, yeah? So today our topic is all about, nerve pain. So ouch, am I suffering from a nerve pain? So I'd like to ask Dr. Khoo this very important question, especially for our audience who are eager to win our special giveaway, Doctor, so how does one know whether he is suffering from nerve pain?
Hang on, I'm just trying to share my screen
so
here.
Dr. Khoo gonna share his presentation from here.
The host is disabled my screen sharing. Can I share my screen? All right, okay. All right.
Okay, audience, can you see the screen shared by Doctor? If yes, you can type 11111.
All right, I'm just giving time. Okay. This is just a disclaimer slides from our sponsors today. All right, so your question is, how do one know whether he or she is suffering from nerve pain, right? So basically,
nerve pain. Yes.
Most people present with all cluster of symptoms, all right? So basically, of course, there's pain, and of course, there are symptoms that suggest that he or she is having some nerve problem. So stuff like things like muscle weakness, especially in your arms and legs, all right? Buzzing sensation that feels like a physical, like a mild electrical shock, and you are regularly dropping objects you are holding. So all these are symptoms that you are having a bit of nerve problem, all right? And plus, if you're having pain on top of all these symptoms, it's quite this may suggest that you're having nerve pain, or what we call neuropathic pain. So stuff like symptoms like numbness or tingling in hands and feet, and even also like, symptoms like feeling like you're wearing a very tight glove and sock. Okay. So if you have all these symptoms, then you may be suffering from nerve pain. So you may or may not, but you may be suffering from nerve pain. Okay.
In this case, what exactly is the definition of nerve pain and what causes it?
Right. So nerve pain, if you search Google, you do a Google search or do a scientific search, the scientific term that we use, most often use, is neuropathic pain. So neuro means nerve, so it's nerve pain. It often results from damage or dysfunction of the nervous system. All right. All right. So our nervous system, we have our brain, our spinal cord, our nerves coming out from a spinal cord that supplies our organs. It can be due to dysfunction of this nervous system. It can be a symptom of many different conditions, such as a cancer, diabetes, or even shingles, kayak. All right. So all these conditions can present as nerve pain. All right. Or nerve pain itself also sometimes can present without any cause. It's primary. We call it a primary nerve pain. Okay. All right. And then, of course, how does nerve pain feel like? So it's burning, tingling, shooting, electric shock like, or even numbness. You feel numb, but you're having pain. So it's a bit paradoxical. You're numb, but you're having pain. So if you're having all these symptoms, it suggests that you may be having nerve pain. So how do you know? How do one know? All right. So there are actually a lot of tools, screening tools that have been developed, to screen for nerve pain. And one of them if you scan the QR code here, it's a neuropathic pain assessment tool, which is kind of, if I'm not mistaken, there are 5 questions that you answer, and at the end there's a score that suggests whether you are having nerve pain or whether you're not having nerve pain. So this is just a screening tool. It's free. You just screen it and you can go into it, and it's just to screen. It's just to have a screening whether you are having nerve pain or not. At the end of the test, if it suggests you're having nerve pain, don't worry. It's just a tool for screening. So you still need to go to a doctor to have a proper checkup to see to confirm that you're having a nerve pain. All right.
Okay, so our site have posted the link in the chat box. So if any of you who are interested to do this free screening, you can actually click into the link. Yeah. So doctor, let us continue. So is there any group of people who are more prone to experience nerve pain, or only the elderly pose a higher risk?
Right. Okay. So this is quite a scientific slide. But you look at this is a percentage of people having nerve pain, and this is different studies being done over the years. All right. So the blue bar here, okay, is the prevalence. Yeah, 42% or 48% out of the total population. All is a percentage out of the total population. So blue bar here is chronic pain. Chronic pain means long-term pain. You can see about 21 to 40% of our population is actually has chronic pain, long-term pain. And out of this, or how many percent are having nerve pain or neuropathic pain? You can see is about probably range about 7 to 18% of, all these are just prevalence study that's been done in different countries, Asia, America, Europe. All right. And to answer your question, whether elderlies are more prone, if you look at this, okay, so like I said, nerve pain happens across a wide range of different conditions. All right, it could be diabetes, up to 20% have nerve pain. If you have cancer, you may present as nerve pain up to 30% or a third. If you have shingles, or what we call kayak, all right, about 7 to 27% will have nerve pain during or even after prolonged nerve pain after having shingles. Even you go for surgery, some surgeries like breast surgery, hernia surgery are more predisposed to nerve pain, about 30%. All right. For those who are chronic low back pain, all right. So let's say if you call it slip disc, all right, slip disc, always call it slip disc. So if your nerve are being pinched by the disc, so up to 37% has nerve pain. Okay. Even people have stroke. If you have a stroke, 8% have nerve pain. If you get a spinal cord injury, it's very high risk of getting a nerve pain. Okay. So your question, whether elderlies are more prone to having nerve pain, right? To answer the question. So you see, there's no targeted study done on elderlies, but you look at elderly, so as you get older, we are more prone to get diabetes, we are more prone to get cancer, we are more prone to get shingles. Of course, we are more prone to go for surgery, we are more prone to get stroke. So as you get older, of course, the risk of getting all these conditions is higher. Thus, of course, the risk of getting the nerve pain is higher. Okay, does that answer the question?
Yeah, so indirectly the elderly group.
Yes.
Yeah.
Higher risk because of your predisposed,
Yeah,
all this
comorbidities.
condition.
Yeah.
Yeah, I'm almost in the group already, I think.
No, you still look very young. Okay, in that case, right, you just now you mentioned about chronic pain and then nerve pain. I guess a lot of us, we couldn't really, differentiate the difference between a normal physical pain and nerve pain. So doctor, could you please explain a little bit further about it?
Right. So what we understand mostly is about normal physical pain. Is where we fall off the bicycle, is where we get punched in the face, is where we get our tooth extracted, is where we go for surgery, is we get a small cut in our hand. All these are normal physical pain. All right. So it's usually aching and throbbing and it's well localized. So if you're having a broken bone at your fingers, the pain is at your finger. All right. It's well localized. And usually it's associated with some amount of tissue damage, injury, broken bone, you get cut, all right, bleeding. So it's time limited. So when the tissue heals, when you fix your bone, when you fix the wound, then the pain will go away. And the normal conventional pain medications, that you always go to the pharmacy, you get over the counter like Panadol, it works. You usually respond to normal conventional painkillers, normal painkillers. How about nerve pain? So nerve pain, the description is very different. Like I said, like a tingling, shock, like burning, associated with numbness. It can be acute, it can be acute, it can be a short term, like if you have shingles or you have a acute spinal cord injury, but it's almost always a long-term, a chronic condition. It happens more than 3 months. It happens in months, years, all right? And it doesn't respond to conventional medications. If you go and see Sin Ye for painkiller, if you're having nerve pain, Sin Ye give you Panadol, it may not work. So for nerve pain, you need different type of painkillers. Okay, all right?
Yeah, which we will talk about it later.
Yes. So effect on nerve pain, all right? So as you can see that, normal pain, your pain will go away when the wound heals, when a condition gets better, yeah, all right. But you see, nerve pain is a long-term condition, it's a chronic condition. So pain here, pain here, as you can see, causes a functional impairment because if you have pain, then you can't sleep, all right. And if once you can't sleep and you have pain, it causes you to have, you are depressed, you are anxious, you don't know why you're having pain. The pain doesn't go away with normal painkiller. And of course, you have diabetes, you have hypertension, you have other conditions that are associated with the pain. And all these are vicious cycle and keeps on feeding with each other, causing you to have functional impairment. Like if you could have jogged or you could have run a marathon, probably now you can't even walk around the park. So all this functional impairment leads to, sometimes if you are still young, then probably you need to, you can't work, all this have a lot of long-term impact. Okay?
I see. Okay, so doctor, before we proceed to the management of nerve pain, okay, so now I'm gonna ask the giveaway question to our audience, okay? So audience, you just need to type the 3 symptoms of nerve pain into the comment box. Yeah, just type 3 of the symptoms of nerve pain into the comment box. Okay. Are you typing in the answers? And we'll definitely choose 3 winners from all of you. Okay, and each of you will get like I mentioned just now, a free health screening voucher worth 399 ringgit at Sunway Medical Centre Velocity. So shoot your answer away in the comment box, yeah? Okay, so I think let's continue from where we left just now, doctor. So since we have now learned about the symptoms of nerve pain, so now let's move on to the management of nerve pain. How do we actually manage a nerve pain?
All right. So management of nerve pain, as you can see, the first step, the most important step is to recognize it. Okay, so we must recognize that the doctor must recognize that you're having nerve pain. So the diagnosis is very important. So most of the time, the diagnosis is missed, or some patients may not just ignore the signs, thinking that it's just normal pain. So the important thing is to diagnose it first. all right? Diagnose that you're having nerve pain. After diagnosis, and find out what is causing the nerve pain. Is there any underlying condition that's causing the nerve pain? If you're having diabetes mellitus, like crunching manis that's causing the nerve pain, then you got to treat the condition. You're having cancer that's causing compressing the nerve, then you got to treat the cancer. All right. So diagnosis and then treatment of the underlying condition. Okay. Next, of course, we can move to medication and non-medication to treat the nerve pain. So this is to control the nerve pain. So the treatment of nerve pain can be medication or non-medication. So the aim is try to reduce pain, not to make the pain disappear. If you can make the pain disappear, it's very good, but we try to reduce the pain. And once we can reduce pain, of course, we improve the sleep quality, we improve the overall quality of life, improve the psychological state, and improve physical functioning. So remember, medication, reduce pain is for us to function and for us to feel better, all right? To improve our quality, all right? If I give you a medication, strong medication like morphine that reduces your pain, but you are sleeping all the time from the side effects, then you're not getting quality of life. So that's not what we aim for. So remember, medication is to reduce the pain so that you can have good quality of life and your function gets better, all right? Of course, if you have other comorbidities, like let's say you have cancer, but you also have diabetes, crunching manis, so we need to treat your other conditions so your quality of life will be better too. Okay.
Yes,
so
you're right.
So treatment goals, remember, primary goal is to have 50% decrease in pain relief. But of course, we got to be realistic. Sometimes we get it, sometimes we don't get it. And with this, we hope that we can sleep better, we can function better, we can get back to our life. We can run marathon again, good quality of life, and our mood better, so that we don't affect others. Okay.
So Dr. Khoo.
Yes.
A very $1 million question. Is this nerve pain curable? I think a lot of our customers has been asking, like, is it curable? Is it curable? And what are the medications that I need to take to help with my condition? And do I need to take it for long term? What happened to my kidney after that?
Right. Okay. So I think that somebody would have a scribble here on the screen. Yeah. Never mind. I think we can still see the slides. Okay, don't worry. So, is nerve pain curable? So to answer your question, it depends on the underlying condition. Okay. All right. Some conditions are treatable. Some conditions are not treatable. And some nerve pains are primary nerve pains. So it happens without any cause. Okay. So let's say if you have a cancer that causes nerve pain, if you treat the cancer, if you remove the cancer, then your nerve pain is curable. Okay. But like if you have crunching manis, diabetes mellitus causes nerve damage in your feet and your hand, and you're having nerve pain from that. If you control diabetes better, of course, it will slow down, or it will not. It will also save your nerve from getting damaged. Then your nerve pain can get better. All right. So it depends. So the answer to the question is depends on the underlying condition. Okay. So what medications that we can use to help people with nerve pain? So these are the usual medications that we can use: gabapentin and pregabalin. All right. Antidepressants such as amitriptyline and duloxetine. Even local anesthetic patches you can get from the hospital or pharmacy helps with nerve pain. So all these treatments, you need to see a doctor to confirm that you have nerve pain, to do a proper assessment and we need to see what condition you have, whether you have diabetes mellitus, whether you have kidney failure, because some medication can be given to patients with kidney failure, some patients cannot, some medications cannot, maybe some patches are better for certain conditions, because of course with medications, there's always side effects, all right? So the most common side effects of all this medication is sedation. You feel sedated, you feel sleepy, and some people get hangover and they can't even, so it depends. So if you're getting a lot of side effects, then probably it's not a good idea to have certain kind of medications. Medication like amitriptyline has caused dry mouth, and it is known to cause falls in elderly. All right. So local anesthetic specialist is quite safe actually, but it can only be used in certain conditions. Okay?
Okay, just a reminder to our audience here, like, what the doctors have mentioned, gabapentin, pregabalin, all these antidepressants, you can only get it with a doctor's prescription if you plan to get it from a pharmacy. So make sure you see a doctor first. Don't come in, walk into the pharmacy and say, I want gabapentin because Dr. Khoo said it's
Cool,
very
said
perfect.
yeah. Now you need a prescription for that. Yeah.
Yeah. So apart from medication, just now Dr. Khoo has also mentioned that we have those non-medication methods.
Yes.
So what are those treatment methods available?
All right. So if you look at the previous slide here, if I can go back. Nope, can't go back.
It's the next slide, I think.
Yeah, next slide. All right. So of course, when we talk about pain management, it's always just, in Asian, it's always a medication. So there's always medication and non-medication, all right? Non-medical therapy. So non-medical, this is important for us to treat pain, to manage pain in a way that, to improve our function, like physiotherapy. If you have backache, and your posture is poor, the poor posture causing you have backache and you don't take care of your back. Of course, if the good with medication, it reduces your pain, but if you don't do physiotherapy, if you don't exercises, your back is going to be weak and you will never get better. So with the pain relief with medication, you need to go for physiotherapy, and this will help in improving your pain as well. Patient education is like, knowing what nerve pain is, what condition or what exercises, what are the things that we should avoid, knowing what are the things that they should do to get better. Psychotherapy, it doesn't mean that you're having some psychiatric problem. Psychotherapy is how we perceive pain, how we think about pain. Most patients have been having this neuropathic pain for a long time, the nerve pain for a long time, 5 years, 10 years, and most of them are anxious, some are depressed, some have low self-confidence, some have very pessimistic thoughts. So psychotherapy is to, get them to think about how to get better, how they can, change their mindset about pain, and how they can actually get better from physiotherapy and also education. Alternate therapies such as yoga, Pilates has been shown to be useful. Some even go for traditional and complete medicine such as acupuncture. Sometimes it may work. So all these, all these are 10%, medication maybe 20%, education 10%, all this add up is good. It's just like a wholesome sort of treatment for nerve pain. Okay.
Yes, you're right. I always advise my customers to go for physiotherapies and be consistent.
Yeah. So when
cannot
you
just
talk
do
about
1-2 days.
No, yeah. The thing about physiotherapy is that they also I go for physiotherapy. So it's like I go, but physiotherapy includes passive, means the physiotherapy will do some hot pack for you, and also exercises, things that you can do, that you can learn from the physiotherapist, and you do it every day when you have free time, like stretching, then things you can do all the time, not just you go and do, but you can also do at home, things that you learn from the physiotherapist. Active lifestyle. Okay.
Yes, you're right, Dr. Khoo. Okay, so this would be the last question from me. Okay, so the question is high dose vitamin B supplement helpful in treating nerve pain, or is there any supplements that Dr. Khoo would actually recommend in sort of like helping nerve pain?
Okay, so the effect, just to answer the question directly and bluntly, all right, sorry, pharmacist. Effectiveness of vitamin B reducing nerve pain has not been established, all right. So, but I say but, if you take vitamin B, there's no harm if you take a normal dose, not the high dose, all right. Normal dose, and if it makes you feel better, it makes you have more appetite, it makes you feel more energetic, why not? All right, but not the high dose that is could be toxic to your body. All right, so the normal dose that you take, but of course the evidence is not there that it reduces nerve pain, but if it helps you in your general well-being, why not? But remember, not the high dose, which may be toxic to your body, all right. But a pointer when you take vitamin B is you have to drink a lot of water, because I think your urine tends to smell a lot when you take vitamin B.
Yes.
Any sort of supplement that I recommend. So this is a very tricky, and I try to be neutral here. So I think a balanced diet will be good enough, All right. Okay.
Yeah, no problem, doctor.
Thanks.
So before we wrap up the session today, I think it's time, since we still have some time left, can we answer some questions from the
Yeah,
audience,
sure,
Doctor?
sure.
Okay, let me look into the questions. Yeah. Okay, Zoe asks like, can doctor share why sometimes sleep and feel numbness just of one side or one hand, not both hands or both feet? Numbness on one side.
Sleep this, is it? You mean?
Yeah, during sleep.
During sleep.
Yeah.
Okay. During sleep, it depends on how you sleep, and your position of sleeping. So when you're sleeping, you may be, when you it may not be a spine problem. You may just be lying, compressing on your hand, and you know that and to let you know, the nerves run from our neck to your chest here and to our axilla, then only to our fingers here. So if you compress on the nerve when you're sleeping, of course you just feel your hand feeling numb. All right. Okay.
So sleep lying.
Yeah, I mean, it's
Lying on the
best
back.
that you lying normally, or you want to sleep in a different position. Make sure that you always change your position. All right. If after changing your position, your numbness goes away, I don't think that's a problem. This probably is your sleeping position, just causing compression on the nerves. All right.
Another question from Liu Ziyan. He asks, does trigger finger and tennis elbow caused by nerve pain?
Yeah, so trigger finger and tennis elbow are inflammatory conditions, inflamed. So they're due to overuse. All right, so trigger finger is where you have pain here, when you finger trigger. All right, if you overuse it, like you play games a lot, you may get trigger finger. And tennis elbow, if you have pain here. You correct tennis elbow, this is the common external tendon. So this is caused by inflammatory condition. So it's the treatment, of course, you need to see a doctor, is rest, one medication. No, it's not caused by nerve pain. This is normal physical pain, and it should go away with if you treat the condition, you treat the inflammation. All right, like certain condition that cause all this. Okay, no, it's not nerve pain.
What about a question from Nurul Haja? She's always having numbness at ring and pinky finger when she wakes up. Is it nerve pain, or how can she resolve it? Numbness at ring and pinky finger. So it's not like the previous questions, like one side of
Yeah. So numbness, but is she having pain? That's my question. All right. No, we didn't say. All right.
Numbness.
Okay. So numbness, ring and pinky finger here. All right. Of course, like I said, it's difficult for me to assess because it's just overlying. So what I can advise is to see a doctor and have it assessed. So, but what I can deduce from pink and ringing finger is these two fingers is supplied by the ulnar nerve, nerves that come from here. All right. So if you compress your elbow here, you can get numbness here. Sometimes when you suddenly hit this part of your elbow here, you get tingling, very painful sensation over here. All right.
Electric shock kind of pain.
Yes, the ulnar nerve. Yeah. So you get compressed here, you get numbness here too. But of course, if you have slip disc, or there's some disc bulge at your neck here, your cervical spine here, if you sleep in an awkward position, of course, it can cause compression also. All right. Having said that, it needs to be looked at, it needs to be examined by a medical professional, by a doctor, to determine where is actually the problem. Is it from here? Is it from here? All right. Is it really the ulnar nerve? All right. Okay.
Understand. And Miss Joanne asked that she says that there's a frequent burning sensation around her knees. If she wears compression socks, then the burning sensation will reduce. Is it a nerve pain or not?
I can't diagnose nerve pain with just these few lines. But what I can say is, do the questionnaire. If the score is more than, if the score satisfies that you may be having nerve pain, like I said, go to see a doctor, all right, or go to see a pain specialist. A normal doctor, if you think that a normal doctor will not be able to help you, if you've seen doctor and they can't solve the problem, maybe go and see a specialist and have it looked at closely, all right. to see whether it's due to nerve pain, or it could, I'm just worried that you may be having any other condition that is causing these symptoms rather than, nerve pain, not nerve pain. Is there any underlying condition that we should be looking at rather than, saying that this is a nerve pain per se? All right. Okay, does that answer the question?
Hi, Dr. Khoo, can you hear me?
Yeah, I think you freeze up for a while.
Yeah, because my side here is having thunderstorm.
All right.
Okay, so the next question is one of the audience, Miss Zoe again. She mentioned that her dad's leg below ankle will turn to red whenever the leg is in a certain position. Is it related to nerve or not? The leg below ankle will turn to red whenever the leg is in a certain position.
To answer the question directly, I can't tell. Really, I don't know. I can't just tell, it could be a vascular problem, it could be a blood flow problem. It could be, when you're in certain position, the blood is not flowing. When you're in certain down position, then the blood is flowing again. So I can't, and this is a very non-specific sort of symptom, so I can't really answer. Of course, there are certain nerve pain that can cause all these, we call it changes to the skin, but like I said, I can't really tell whether it's due to nerve or not. It could be due to vascular, blood vessel problem also. So again, like I said,
see a doctor.
See a doctor and look at. So like I said, so to answer the question, I'm not so sure. All right, it could be due to blood flow problem. All right, it could be. All right, okay, because redness could be due to. It's definitely there's some association with blood flow. Of course, the nerve can control the blood flow as well. Right.
So Dr. Khoo, actually, when someone suspected all this, not sure whether is it nerve pain or not, which doctor should they go to? I mean, in terms of specialists, should they go to osteopedic first or orthopedic first, or find you?
Oh, okay. I mean, you can. I mean, I always welcome patients to come and see me. But all right. So if you think that so orthopedics doctors that deal with bones a lot. All right. So of there are orthopedic doctors who are subspecialized in spine. So these doctors are really good in diagnosing spine problems. So if you go to them, they may be able to tell whether you're having a spinal cord problem, whether there's any slip disc that's compressing on the nerves that is coming out and supplying the leg. All right. Of course, if you have pain, let's say if you have a cesarean section and after cesarean you have pain over your scar and feel like it's nerve pain, of course you don't see an orthopedic doctor for this because it is a nerve pain, type of nerve pain. Then you tend to see a gynae's problem. All right. But of course, if you see somebody with experience in pain management, of course they can sort of point out that you're having a nerve pain. All right. Okay. So it's so my answer to the question is if we can identify doctors who are trained in pain management, they can pick it up. And let's say, and once they pick it up, once they know what the problem is, they can refer to the appropriate doctors. Let's say if you come to me with let's say with leg pain, and I find out it's actually a spine problem, but when I do a scan to find out which nerve is getting involved, like MRI, let's say I find there's a disc compression. Of course, then I can refer you to a spine surgeon. This is the best way to work. Or if I find there's a tumor there, then I refer you to a neurosurgeon or even an oncologist to treat the cancer. Okay, so it's nerve pain. It's always always a symptom. We need to find out why you're having the nerve pain, right? If you're having nerve pain from diabetes, let's say conjunctivitis, of course, you see your doctors who are taking care of the diabetes. If he can treat the nerve pain, he will treat the nerve pain. If let's say he can't treat, then he'll refer to a more specialized person like me to treat the nerve pain, right? Depending on what you have actually. Okay.
Okay, Dr. Khoo, actually, I saw a question from the chat box. It's from Joanne. Yeah, she asked whether Dr. Khoo has treated a patient with arm pain before after vaccine booster injection. Actually, I get quite a lot of these questions from my pharmacy as well. Quite a number of them actually came into,
Oh,
yeah.
really?
Yeah,
I
pain.
haven't. Yeah, I haven't. I mean, I haven't seen anybody with complaints of arm pain months after vaccine injections. I've seen people with COVID, after COVID, having we call it long COVID syndrome. So another condition that is going to have a lot of pain now is going to be a long COVID. No, after COVID, long COVID, then you get all this nerve pain, very non-specific sort of nerve pain, right? So whether I treated anybody with vaccine pain injection at arm, no, I haven't. All right, so I haven't seen anybody. I'm not
So go look
aware
for
of
Dr.
that.
Khoo.
I mean, you can look for even an orthopedic surgeon or even a doctor just to have a look at it, to just to rock, is there any infection or anything that's going on? If not, yeah, we see how it goes.
Okay, now more questions regarding medication now, Dr. Khoo. So Josephine asks, is the medication for nerve pain will cause hold on, let me digest the questions a bit. I think she's asking about the side effects of the medication and will they cause allergy reaction?
Okay. Gabapentin. So you can see that a lot of myriad of medication that I've listed out. So why? Because sorry to say, nerve pain medications are not very effective. Only if the number you need to treat means every 4 or 5% you treat, only get one will get a good effect. All right. So do you get allergic reaction? So different people are allergic to different sort of medication. So we don't know until you take it. If you develop rashes or signs that is suggestive of allergy, then yes, you have the allergy. You are allergic to that medication. But pregabalin, gabapentin, duloxetine, amitriptyline, I haven't seen much allergic reaction, true allergic reaction, as in rashes, itchiness, that kind of. Some develop side effects like palpitation or that. Those are not really allergic reactions, so are just like side effects. All right. So true allergic reactions, itchiness, rash, all that, I rarely see, I seldom see, but yes, it can happen.
Yes, because
yeah,
anybody can be allergic to anything.
Yes.
So okay, the next question will be, can someone take pregabalin or gabapentin for long term?
Okay, this is again depends on the age group. All right, long term, 1 year, 2 years. Yeah, I have patients been on that for 1 year, 2 years, no problem. 10 years, maybe not, depending on your underlying condition. But let's say if you are 30-year-old and you have nerve pain and you're on pregabalin, but you're planning to get pregnant, of course you need to come off that medication before you get pregnant because it may affect the baby. But let's say you're a 60-year-old, you are having pain and you're on pregabalin, I think you can be on long term for a year or two, provided that you go for follow-up with your doctor to have regular blood check to make sure that your kidney is not getting worse. Because if your kidney is getting worse, sometimes your liver is getting worse, then we need to stop certain kind of this medication because it's contraindicated. All right. Again, yes, you can be on long term, but you need to be on follow-up to make sure that you are okay on this medication. Means you're all right. You need to be monitored. Okay, you can't be on this medication on your own for long term. It's not advisable. Okay, you need to be on. If you want to be on long term, you need to be on a doctor's advice, and make sure that you are being looked at regularly.
Okay, let me check whether is there any more questions. Okay, what about nerve pain due to shingles? Yeah, can it be treated? Is it curable? I think she's trying to ask, is it curable?
All right. Okay. So the thing about shingles is, if you can avoid getting it, then avoid getting it. If you can prevent it, right? So because there is a vaccine for shingles, all right. If you, for older generations, older people, if you can avoid it, then avoid it. Because if you get shingles, because the virus that causes shingles is the same virus that causes chickenpox, all right?
Yeah, the herpes.
So yeah, herpes zoster, and it attacks the nerve. So when it attacks the nerve, of course, chances of you getting nerve pain is very, very high. And I've treated quite a number of patients that develop shingles. It can be at their face, can be at their forehead, can be at their chest, can be even at your genital area. Can you imagine pain at the genital area? All right. So the thing is, patients can get severe nerve pain. This is called acute during the active phase of shingle itself. All right. So if you have a lot of pain during the active phase of shingles, then your risk of developing long-term nerve pain is very high. Okay. So if you have pain during the active phase of shingles, if you can seek help, please seek help. Because if we can control the pain well during this phase, then your risk of getting long-term pain is not that high. All right. So I've seen some patients that come to me late, so no matter what I do, no matter what medication I give them, it doesn't work. So sometimes we may offer very invasive way of treating the pain, like injections to the nerve, but all this have no evidence, not much evidence. But this is one of the conditions if you have shingles, long-term shingles, we call it post-herpetic neuralgia. Means after the shingles, you get long-term pain, even though your shingles has healed. You have people getting that. All right. Lidocaine patches may help in this sense once your vesicles has healed. So whether it's curable or not, so my answer is if you have some yes, some no, but if you have a lot of pain during the active phase, get help, get your pain treated well, then your risk of getting a long-term pain is not high anymore. All right. So I've treated patients that came early to refer to me early, and they're doing okay now. They're doing well now. All right. I've got still patients coming to me late and they're still having pain until today. So depending, some medications may not work. So.
Yeah, that's a really great tips from Dr. Khoo. Treat it early, yeah.
Yes.
Don't be stubborn.
Yeah.
Yeah, so the next question from Selena is, her friend actually has this venous dermatitis, experiencing tightness at the ankle area, but she knows that it's not nerve pain. And she's asking, like, how is this related? Venous dermatitis and tightness at ankle area.
I'm sorry because I don't even know what venous dermatitis is. I'm not a dermatologist, I'm sorry, so I can't really comment on that. What I can say, maybe when you're having venous congestion, the leg may be swollen, and when you're swollen, you get stretch at the ankle area. So this is just my guess. I'm not seeing her, so I can't really comment because I'm not a dermatologist. It's something that I can't really tell. It's out of my specialty. All right.
What about plantar pain, like pricking pain kind of pain?
Plantar pain. Plantar pain. Again, a lot of causes. One of the common causes that I myself has is plantar fasciitis. The plantar has a fascia there and it's inflamed. All right. No, it's not a nerve pain. All right. Okay. Plantar fasciitis is a form. Some people may get chronic long-term pain, but it's not a form of nerve pain. It's an inflammation of the plantar fascia that that's sort of lying the sole of your foot. Right? So again, it's not a nerve pain. Is due to inflammation. Of course, the treatment against is painkiller rest. If long term, then you need to go for physiotherapy, support, all sort of stuff.
Yeah, a pair of good shoes.
Yeah, physical therapy again. Stretches help. Okay.
So I see a lot of our audience here. Their questions are still, quite confusing. Whether is it a nerve pain or not?
Yeah. So again, the questionnaire. Take the questionnaire. I think it's a period of 5 questions. And if it is suggestive of you having a nerve pain, then you see your doctor that you are comfortable with, or see somebody that see a specialist that is specialized in pain, just to see whether you're having a true nerve pain or it's not a true nerve pain. So because the way we diagnose nerve pain is by symptoms. You telling us how you feel, what are you feeling every day, that kind of thing. The next thing we do is we examine you. We do certain tests to find out whether we think to zero in where the pain is, which part of the nerve. Then we'll do tests to confirm it. There's certain tests we can do scans, we can do nerve conduction study to test the nerve to see whether it's that nerve causing the problem. All right.
Okay, thank you, Dr. Khoo.
Thank you.
I think this is the end of the session, but before wrapping up, do you have any last word to advise for our fellow audience?
Okay, so if you feel, I mean, remember the pain management is just not about medications, medication. Remember, there's medication and non-medication. So if you're having long-term pain, remember, medication, you aim to reduce your pain, but remember that, exercises, physical therapy, how you think, how to get back on your feet, that's important too. All right, learn how to deal with pain, manage pain in non-medication way. But medication can just help you this much. All right. Again, if you can, always see a doctor to find out why you're having the pain, to get to the bottom of it. All right. Treat the underlying condition. If you have nerve pain from your diabetes, for your kencing manis, remember, control your blood sugar. If you control your blood sugar, then you can limit the damage to your nerve. Then you can always treat the underlying condition. If you're having backache because of bad posture, because of you being overweight, then of course, exercises, reduce your weight, that will help you in reducing pain. Always treat the underlying condition. Remember, pain management is treat the underlying condition, medication, and most importantly, non-medication, the physical way of managing your pain. Okay.
Yes, thank you very much, Dr. Khoo. I totally agree with what you have mentioned just now. Okay, so thank you everyone who has joined this webinar, and congratulations to all audience today for getting the 500 caring points. If you missed the earlier part of our webinar, but do not worry, because we will post a playback later on in our Facebook page. So while you are at it, don't forget to like Caring Pharmacy and Vitri's Facebook page. So good night,
you
everyone.
can like my page also.
What's your?
I have a page also.
Yeah, Dr. Khoo, what's your page?
You just KHOENGLEA, just type my name. You can find my page easily.
Okay, Dr. Khoo Eng
Eng
Lea.
Lea,
Remember? Yes, Dr. Khoo Eng Lea. Okay, thank you everyone. Good night. Thank you, Dr. Khoo. Bye bye.
Bye bye.